Thank you for joining us for this on-demand MDA Engage community webinar on mental health for individuals with limb girdle muscular dystrophy. My name is Michelle Barrios, and I am the Community Education Specialist at MDA. This webinar is part of our larger MDA Engage flagship community event series, which focuses on bringing the neuromuscular disease community together around education and social opportunities. Be sure to visit the MDA Engage section on mda.org for updates on upcoming virtual education events. Let's review the objectives for this webinar. Participants will learn how limb girdle muscular dystrophy can affect an individual's mental health, discuss how an individual with LGMD can talk about their mental health with a caregiver or loved one, learn how a caregiver or loved one can talk about mental health with an individual with LGMD, and review mental health resources and support for individuals with LGMD. Now I would like to introduce our speaker. Monique Costello is the clinical social worker for Washington University Neuromuscular Disease Center. She established the social work role for this clinic in 2019. She has been working closely with the MDA and ALS Association since this time to develop that role and ensure the social and healthcare needs of their clientele are being met. Monique completed her master's in social work at the University of Missouri in 2012 with an emphasis in clinical care. Since that time, she has been a medical social worker, starting out at St. Louis University Hospital. She has specialized in working with general medicine patients and spent a number of years focusing directly on psychiatric care needs. She has also practiced as a mental health therapist since 2016, in addition to her clinical role within the hospital setting. Additionally, she is an adjunct professor of sociology at Jefferson College, an area community college. Monique is a wife and mother who likes spending time with her family and rescue dogs. Prior to COVID safety and travel restrictions, if any free time was found, she liked to plan trips to new cities and check out new aquariums. Sea otters are her favorite. And with that, I would like to turn over the webinar to Monique.
Thank you so much for that introduction. We are going to share here. As previously stated, we are going to be talking about limb girdle muscular dystrophy and how it affects an individual's mental health and wellness. I am a neuromuscular social worker working with the Neuromuscular Disease Center at Washington University School of Medicine in St. Louis. Some discussion points, as Michelle already outlined, but things to anticipate in this webinar is, first we are going to talk about limb girdle muscular dystrophy and how it affects one's mental health and how the two interact and feed on one another. Secondly, we're not just going to be talking about mental health, but we're going to talk about how you can talk about your mental health, either with a practitioner, your medical providers, or your support group caregivers around you. Next, we want to talk about caregivers' mental health, not only the mental health of your caregiver, but how a caregiver can talk to an individual with limb girdle muscular dystrophy about their mental health. And we'll then transition into talking about steps you can take to improve your mental health, things that you can do from home, ways to reach out to in your community to help improve your day-to-day life and your mental wellness. Lastly, we'll go over some national resources that you can utilize, as well as how to find local resources near you. So first, let's talk about how limb girdle muscular dystrophy can impact an individual's mental health. Physical limitations for limb girdle muscular dystrophy can oftentimes bring on secondary problems. Secondary problems is a common theme that I talk about with individuals, especially in mental health. Oftentimes you'll identify a problem and feel stuck and struggling with that problem, but really what needs to happen is break it down so that you can create an element of change. So an example of this might be isolation and loneliness. This is something commonly coped with individuals with muscular dystrophy, especially once it's progressed. Individuals find that isolation and loneliness stems off of building a certain way of interacting with individuals. Individuals with limb girdle muscular dystrophy oftentimes have difficulty navigating stairs and using ADA accessible ramps to get to certain events, locations where friends or other family members may attend, or even going to a friend or family member's home. It becomes challenging to get in and out of their home, in addition to whatever challenges you may have getting out of your own home. And in coping with that, you tend to avoid going to events, avoid going out with friends, avoid having them over. And it creates a cycle of isolation and loneliness, which then can build on negative emotion. So while you may be at home and saying, I'm tired of feeling so lonely, I'm tired of feeling so isolated, break that down, find out what is the first problem leading up to that, what is likely a secondary problem. By breaking those things down, then you can create an element of change. You can dissect what it is that you are willing to change in order to create a healthier lifestyle, and how to bring other people into helping you make those changes. And in doing that, it is important to identify your thoughts and emotions that you perceive with those problems. If you've identified a problem in your lifestyle that's creating a negative feeling, you need to find a way to clearly identify what it is that those emotions are. What are those thoughts, so that you can adequately reach out to others and express what it is that you're going through, so that you can create an element of change. That self-awareness and mindfulness can be really challenging, despite how simple it may sound. Some people may say, well, it's easy to tell you how I feel. I feel this, I feel that. Well, let's take it a step further. Why do you feel that way? Is there something more complex underlying that? For example, anger is a common emotion that people feel. I feel angry about my diagnosis. I feel angry that I need to see a therapist. I feel angry that I need medication. Anger oftentimes is an emotion that people feel because it feels like emotion they can be in control of. Why are you angry? Are you angry because of another emotion that you're avoiding to feel? Because we don't like the way that emotion feels. Not that we like to feel angry, but at least when we feel angry, we feel like we can push that emotion off onto something else. This emotion is due to something else, and I can be in charge of that. And while that's important to us, it doesn't help you change anything. And the best part of addressing your mental health is finding ways that you can change what's happening in your life, so that you can gain a sense of control, and so that you can gain a sense of moving forward in the hopes of finding something better. Another way that limb girdle muscular dystrophy can impact an individual's mental health is how limb girdle muscular dystrophy affects your social and emotional roles in life. Oftentimes, if you've been diagnosed with muscular dystrophy later in teenage years, early adulthood, later adulthood, you find that you had thoughts and perceptions on what your role in life would be like. You equated certain activities for what your role in your friends and family members' life would be. To be a dad means to throw a baseball to my kid. To be a mom means to be able to take care of my child. I shouldn't need care from my child. To be an adult means I shouldn't need to stay with my parents. I shouldn't need help from my parents. And coping with those changes in social roles and being those individuals with limb girdle muscular dystrophy can impact how you reflect on your life and how you find joy and mental wellness. So there's a big element of coping with the fact of finding that you're not what you thought those roles would be, but you're still valid and important in what you offer. There's an element of self-acceptance and self-forgiveness that can provide an element of peace to move forward and to let some of those emotions go and be more present in the person that you are and what it is that you do offer to your family and friends around you. Lastly, let's talk a little bit about quality of life. I don't mean to go in too much onto this because I'm sure anybody who has seen a physician recently has talked about pain management and fatigue management for maintaining their quality of life. And it's probably a little broken record of me to say, but the more you are managing your fatigue and pain through physical therapy exercises, through managing your quality of life, the less mental energy you're having to expel on the discomfort associated with pain and fatigue, and the more mental presence you're allowed to have with yourself while you're enjoying those things in your day-to-day life. And that's why those things can be so important. Not only is obviously pain and fatigue uncomfortable to cope with, but it can be emotionally and mentally draining as well, and take you away from the things that you do find joy in. Talking about your mental health and wellness, the biggest theme I want to bring up in today's talk is that mental health is health. I want you to be able to find ways about talking about your mental health and wellness the way you talk about your physical health with the people around you. Do you understand what it means to cope with mental illness? Do you understand what your mental illness looks like within yourself? Do you understand the patterns that you're seeing? Do you understand the things that help you and the things that hurt you and hold you back? Those language skills and emotional intelligence can be difficult to develop, especially as we live in a world that's just really starting to change the social stigma of talking about mental health. It's important that you take some time to educate yourself on the tools and verbiage used in mental health language, but also how it relates to you. Take some time to be, again, self-aware and mindful. Do these things resonate with you? Can you associate with the things that you're reading about and learning about? Or do you not? Move on to other topics and maybe it's something else. But also be aware of the people around you. Do the people around you understand what it means to be mentally well, to focus on your mental health and energy? Do they understand the language that you're using, and do they believe what you're telling them? If not, it might be some time to introduce them into what it is that you're starting to learn about yourself. Make them a part of your learning process if they're willing. And so that way you have somebody you can share this with, just like you might share what you're learning from your physician about your diagnosis with limb girdle. Just like you talk about adaptive equipment and adaptive ways of living, you also do the same with your mental health and wellness. And it's important to share those things with others so that they can be aware and set healthy boundaries with you, as well as it may even be helpful to them. You never know what someone else is coping with. You should be able to talk about your mental health symptoms as easily as you talk about your physical symptoms. You should be able to talk about it with your doctor, or a counselor or a therapist or support group leader or caseworker. It's important to seek professionals when you are taking this journey towards learning about your own mental health and wellness. There is a lot of research out online that's easy to get to, and there's some great tools. There's a lot of also not great tools. There's a lot of blogs by people who are talking about their personal experiences, and it's not necessarily founded in science. So it's important to, while you're doing your own personal journey, to be collaborating with somebody who can help you professionally as well, and finding that right fit for you. Just like you found the proper neurologist to help you with your limb girdle muscular dystrophy diagnosis, you want to find somebody who can help you with your mental health diagnosis as well, and provide you maybe some more insight into what they know as a professional for helping you move forward. And it kind of makes it more personalized to you as an individual. I also want to have a caveat about medication as a useful tool. A lot of people can be resistant to using medication for depression or anxiety, mood disorders. And I want to say that there's something to be said, and it's honorable, about wanting to do something without medication and really utilize your best skill sets to use proper coping skills. But mental health is just that. It is health. Sometimes there is an illness, there's a chemical imbalance, and your brain is struggling, and it needs medication to start working at its best capacity. Sometimes we can't put our coping skills into best practice when our brain is struggling to just function at its best capacity. So I would encourage you to not steer away from medication if you're finding that coping skills just aren't enough for you. And talk with your provider about it. Talk with a psychiatrist or primary care physician. What's going to be the best process for you? What's available to you? And to know that one medication isn't going to be the right fix. It is a journey to find what's right for you. And once you start to feel better on a medication, if that's what you need, along with your coping skills, to then transition the conversation to, this is working, this is great. Now, do I feel better because this is working and I need to keep doing this? Or now this is working and I'm ready to wean off of medication? Always have that conversation with a medical professional. Never just stop medications completely, and always be sure to follow their recommendations and guidelines. But don't hesitate to speak up and say what you're most comfortable with and make it a collaborative effort. You're a part of your healthcare process, both mental health and physical health. Let's transition to caregivers talking about mental health with the individuals that they're caring for. Sometimes it can be challenging to be a caregiver for an individual who has an undiagnosed mental illness when they also require physical care. I often talk about overcoming apathy. It can be challenging to care for somebody who may appear to be grouchy or disconnected, unappreciative, but I would challenge you to look further into why they're having those personality traits. Is that who they are as a person, or are they coping with something much larger? Is there an element for maybe needing to bring in the conversation of, we need to talk about ways that can improve your mental health so that you're not feeling these negative emotions all the time, as well as it provides you some insight into the kind of person that you're caring for and understanding them as a holistic whole person, that they're more than just the needs that you're caring for. It can be challenging, but as a caregiver, there's more than just the physical care that you're providing as well. Check in with yourself. Make sure you know why you're finding challenges with this individual. Is there a physical challenge that maybe you're just not able to manage anymore because either you're getting older and your body is changing, or their needs are becoming more challenging to give and you need to get external support from other individuals? Or is it their emotional care? And if it's their emotional care, do you guys have the skills to work together to improve where they're at right now and to build on a better relationship so that there's hope moving forward? Or is this something that is outside of your ability to care for? These are important questions for knowing your limitations and boundaries, not only for yourself, but so that the individual you're caring for is actually getting the best care that they need. Once you're able to start having the conversation about mental health, once you've approached it the first time, it's important to check in frequently. And I use the term frequently very loosely. You don't want your entire relationship with the individual to just be about mental health. You want to make sure that there's an element of balance in this, but also it's not just a one and done conversation. Mental health is something individuals cope with oftentimes throughout their lifespan, and things can change in it as well. So when you ask frequently, be sure to just ask when you are noticing some changes, or just to let them know that you're open and available whenever they're ready to. The more you talk about it, the more normalized the conversation becomes. Like I said previously, we're living in a society that's just really becoming more open about these conversations. And we have much broader generations that are coping with this that maybe haven't always felt as comfortable talking about these things. But the more you're at ease with talking about it, the more helpful it is to know that it's okay for them to talk about it as well. With the varying generations, there are going to be individuals with limb girdle muscular dystrophy who are not as okay with talking about mental health. be it because they grew up in a household or an environment that didn't recognize that mental health was actually an issue of concern, it doesn't exist, or they just don't feel comfortable with it yet. There are physical characteristics that you can ask about in ways that mental health can sometimes manifest into, to hopefully kind of sidestep those conversations and help give you a more clear depiction of what they're going through. I've included some of those questions here. Be sure to ask them about their sleep. Are they sleeping too much or sleeping too little? Or are there drastic changes in their sleep patterns and cycles on a regular basis? Are they having too much food intake? Are you noticing that they're eating more often than usual? Are they eating less quality foods? Are they coping with something? Are they trying to find pleasure in food rather than pleasure in other activities? Or are they eating too little? Are they apathetic about their lifestyle and not seeing much reason to find nourishment? Check in with their focus. Are they able to focus on an activity for more than 5 to 10 minutes at a time? And monitor their irritability. Do you find them becoming more irritable with you or individuals around them for reasons that are unexplained and you don't know why they're behaving in that way? As well as check for engagement. Be sure to be engaging yourself with individuals with limb girdle muscular dystrophy and make sure that they're able to respond in a way that shows that they're involved with you as well. Now, take that with a grain of salt because there's an element of people that just have good days versus bad days, but these are some primary key factors in the way that mental health can manifest into physical recognition. And by approaching mental health as a physical characteristic, it's a great way to kind of step into those conversations when the person you're caring for may appear to not be ready to talk about their own mental health just yet. And caregivers, it's important for you to check in on your own mental health as well so that you can be the best caregiver for the loved one that you're taking care of. The first thing, and I'm sure many of you have talked about, is burnout and fatigue. Be sure to be checking in on the state of your physical, emotional, and mental exhaustion. When you go to bed at night, you take that deep breath and you just kind of allow yourself to rest for the evening. Take note of, is it physical exhaustion that you're feeling? Is it your shoulders, neck, back, knees, things from providing physical care to an individual? Or is it stress and tension from being kind of clenched up from carrying the emotional and mental stress of the day? What is it that you're allowing yourself to kind of unwind with in the evening? If you're trying to do more than what you're physically capable of doing, it can be unsafe for both you and the person you're caring for. And it might be time to start talking about getting an additional person to help you with the individual you're caring for. And it can also be financially burdensome as well. Oftentimes with caregivers, they tend to, I use the term treat yourself. If you're treating yourself too frequently, it can become financially difficult. You know, if you've had a bad day and you're getting a glass of wine, shopping spree, a nice meal, an ice cream, something to make yourself feel better, those are all fine things to do when you're having a challenging day. But if you're noticing that you're having to do that more and more often, it's time to recognize that there is an element of change that needs to occur because there's something systemically happening between you and the individual you're caring for that's not allowing for you both to be at your healthiest. And so that's something to be mindfulness and aware, and you're likely going towards burnout. You don't have to do this alone. It's time to seek help and it's time to delegate tasks. It might be for yourself, it might be for others, and it might be for the individual that you're caring for. It's important to set boundaries. Oftentimes as caregivers, it's difficult to set boundaries. Once you get into the role of providing physical care for an individual, it can become easy and almost even unnoticed that you start to do all of the care for the individual. Be sure to hold the individual responsible for things that they can do on their own. It helps provide an element of independence for them as well as self-assuredness that they don't need to be dependent on somebody else, and alleviate some of that care and mental concern for yourself. So talk with one another, check in with the person that you're caring for. Ask them what are some things that they could be doing for themselves that you've just started to take over for them. And check in from there. Are you still overextending yourself? Is it time to start getting another person involved? You're not expected to do this alone. We talk oftentimes about how it takes a village to raise a family. It takes a village to raise children, but we don't talk about how it takes a village to help an individual with chronic illness. And so you can't be expected to do it alone. And if you are, it's likely that you're overextending yourself. Let's talk about ways you can be proactive in managing your mental health. Again, a little bit of a broken record here, but exercise is incredibly important for individuals with limb girdle muscular dystrophy. I'm sure you've all heard it from a physician, and probably individuals who don't have limb girdle muscular dystrophy have heard it from their physicians as well. But your exercise program is going to be a little unique. Make sure you're working with a physical therapist who understands your specific kind of muscular dystrophy and the kinds of exercises you can be doing to manage your fatigue, keep up your range of motion, and managing your muscle mass. The MDA provided a great talk back in August of 2020, and that video is still up on YouTube. I highly encourage you to look at it. It is about a 1-hour talk led by a physical and occupational therapist. And they provide some excellent resources if you're not able to see a physical or occupational therapist right now, or if you're feeling like you are having difficulty getting out and seeing somebody. Seek counseling, seek a mental health professional. As I said earlier, this is something that is a medical and scientific process. It is important to make sure that you're seeing a professional in addition to managing your own mental emotions. Cognitive behavioral therapy has been studied in numerous research studies to be one of the more beneficial types of therapy that an individual can receive when coping with mental health, especially with chronic illness. CBT is often referred to, is practiced by many therapists and is not challenging to find at all. Practices changing your thought processes and your perceived reward systems and perceived negative thoughts and helping to change those emotions so you're finding more joy and feeling better and healthier in a day-to-day life. It's also important to find the right fit when seeking a counselor. Not only somebody whom you get along with and you feel an ease and comfort with, but somebody who understands you as a person. Oftentimes, a lot of my clients want to find a therapist who understands an individual who has limb girdle muscular dystrophy or even just muscular dystrophy. And I will say it can oftentimes be a challenge. This is not a specialty that a lot of therapists tend to have. But that being said, you are going to be the expert on what it means to live with limb girdle muscular dystrophy when you go into a counseling session or when you go into a psychiatry appointment. When you go to see your neurologist, they are an expert on coping with your neuromuscle diagnosis. And they do understand depression, but they're not necessarily an expert on it. So maybe it might be more realistic to find a therapist who understands of what it means to live with chronic illness or grief, as far as grieving the loss of a social role that you thought you might have. And you can be the one to explain to them what it means to live with limb girdle muscular dystrophy. And they'll be the experts in explaining on how to manage your mental health and wellness, your depression symptoms, your anxiety symptoms, or your change in mood. Because that's ultimately what you want to see them for, and they should be able to be qualified to help you with that. Something we pride ourselves at Washington School of Medicine is comprehensive care. We provide a multidisciplinary approach to our clients that come in. Not every clinic is going to afford the resources to do this, but I highly recommend you try and find it if it's available. All of our clients that come in have the opportunity to not only see a neurologist that specializes in neuromuscular disorders and research, but we also have orthotics and wheelchair representative on staff and on site, as well as physical therapy, dietary, nursing, and social work available to you as well. Now, if you are not able to find a clinic, a neurologist that's able to provide you with these resources, make sure that you have a physician who's asking you about those resources, who's mindful of the importance of physical therapy, who's mindful of the importance of your mental health and well-being, and is asking you those questions and making sure you're getting that care and communicating with your physical therapist and your orthotics individual so that you're getting a full and comprehensive look at your care. And it's more than just a doctor's visit, because your care encompasses so much more than just seeing a physician. There's lots of things that are helping to improve your mental health and well-being and your quality of life on a day-to-day. Some resources for help and support. I've been most impressed by the Limb Girdle Muscular Dystrophy info.org website, and I can't recommend them enough. If you want to go to lgmd-info.org, they have some really great resources. A lot of my clients want to be involved in support groups. They want to find other people who are coping with what they're coping with, and they want to learn from one another. It can be challenging to do that in person and in a city, finding other individuals who are coping with what you have within the limitations of your community. But the LGMD website is really great about national support groups, meeting online, especially during times of COVID when we're isolating as it is, reaching out and finding other individuals. And their support groups seem to be really great. They break it down even by subgroups as well. So you're really finding people who truly understand what it is that you're coping with, as well as other blogs and podcasts and YouTube channels if you're looking for other information, as well as tools to maybe even share with other individuals to let them know what you're going through as well. If we are talking about things that maybe are a little lighter than what you're coping with, if you're coping with something much more heavy than what we are approaching in this conversation, I would really encourage you to reach out to the National Alliance on Mental Health, NAMI, or the National Suicide Prevention Line. These resources are not just used for individuals who are in a suicidal state of mind, but just in a state of crisis. If you're reaching a really dark place and you're finding it challenging to really break the cycle of what you're feeling, please call these numbers or go to their websites. They also offer text and online chat support so that you can talk with somebody at your comfort level. And a really great resource for helping you find other things in your community as well. Which brings us into how you can find support in your community. Oftentimes what I start with my own clients is checking with your insurance provider. If you want to call the customer service number on the back of your card or go to their website, they'll often provide you with a list of mental health practitioners in your area, as well as inform you of what their specialties are and whether or not their buildings are ADA compliant. If your insurance is through an employer or a spouse's employer, you may even have free counseling through an EAP program, usually anywhere from 4 to 8 free sessions, and then transitioning into using your insurance provider. You can always check with your customer service number on the back of the card to find out if that's a benefit that you have. If you're still struggling to find the right fit, talk with your doctor or physical therapist or caseworker if you have one. It's likely if they're an individual who works with muscular dystrophy that you're not the first person with muscular dystrophy to want to talk to somebody, and they may have resources from other clients that they can share with you. And if you're an individual who it's difficult to get out of your home right now due to adaptive equipment or because of COVID restrictions or transportation needs, I often reach out to local centers for independent living because their primary focus is helping individuals stay in their homes versus moving out into assisted livings or nursing facilities. So in that, they often are aware of programs that come to your house, and they may even know of therapists that do home visits and could come to your home if that's something that is a barrier to you. It would make your process for seeking a mental health practitioner easier. And you can always contact your local MDA representative. If they're not aware of a resource to help you, they're usually more than willing to find a way to find those resources for you. Lastly, I just wanted to provide some of the resources for the science behind some of these recommendations. If you'd like to look further into these journal articles, please feel free to. There's some excellent reads. And with that, I just want to say thank you for your time. I hope this has been helpful. I hope you're finding and seeking the help that you need and the language to express what it is that you're coping with so that the people around you can help you get where you need to be. So thank you, Michelle.
Thank you so much, Monique, for your presentation. I really appreciate the time you took to create your presentation and your knowledge that you shared with us today. I really appreciate it. So thank you so much.
Not a problem. So glad to be here.
We would love to hear your comments about this webinar. If you have a smartphone, open your camera and point it at the QR code on the screen, and a link to a survey will pop up. You can also visit the URL posted in the event description to complete the survey. If you have any questions after this webinar, please feel free to email them to mdaengage@mdausa.org, and we will follow back up with you. I would also encourage you, if you would like additional information, to view the MDA Engage on-demand webinar titled Psychosocial Support for Living with a Chronic Illness. If you are new to MDA through this program and are diagnosed with one of our over 43 diseases under MDA's umbrella, or are a loved one of someone who is diagnosed, we encourage you to stay engaged with MDA. You can do this by visiting mda.org/join and completing a short form. This concludes today's MDA Engage webinar, Mental Health and Limb Girdle Muscular Dystrophy. Thank you very much for watching and have a great rest of your day.